You've seen all the pink ribbons for breast cancer awareness, but when it comes to your own body, are you truly aware of the possible signs and symptoms of this common cancer? Everyone has breast tissue, which means anyone can develop breast cancer. While hereditary factors can contribute to your likelihood of getting breast cancer, the reality is that 90 to 95% of breast cancer cases are sporadic, meaning they're not related to any known genetic predisposition to the disease. So it's important that you know what kind of changes to your body might be signs of breast cancer. By performing monthly breast self-exams, you can become familiar with the normal monthly changes in your breasts and be primed to notice any worrisome changes. Make sure to do it at the same time each month. If you menstruate, you should do the self-exam 3 to 5 days after your period ends. So what are the warning signs of breast cancer? Pay attention to any new lumps or thickening of the skin on your breast or underarm. Even a lump the size of a pebble or a pea can be a cause for concern. You may also feel a small hardened area under the skin, not quite a lump, but not normal either. Be on the lookout for any changes in the general size, shape, or contour of your breasts, particularly if those changes happen on one side but not the other. And tell your doctor if you notice a change in the look or feel of the skin on the breast or nipple, like dimpled or puckered skin, redness, a scaly texture, or general inflammation. Pay attention to other changes to the nipples too, like if one nipple sinks inward or if you notice a clear or reddish fluid discharge. If you notice one or more of these signs, schedule an appointment to talk to your doctor. Keep in mind that most lumps and abnormalities aren't cancer, but it's important to get checked out. Doing regular breast self-exams is a great way to maintain breast health and detect cancer early, when it's easier to treat and more likely to be cured. So think pink and get to know your breasts. Self-exams are an act of self-care, and they just might save your life.
To the Vine podcast happening live at Abeka Free Pipe at True Vine International Church. True Vine International Church is headed by Pastor Norbert Freeman. And then we are in the month of October, which is the month of breast cancer awareness. Last week, we had a beautiful session and a good conversation on breast cancer. We are here tonight again to talk about breastfeeding, everything there is to know about breastfeeding. We are going to have a conversation, talk about it, and learn. As I said last week, the Vine podcast is here to stay. We are here to talk about lifestyle, educational purposes, family, everything there is to know about life. We will be discussing it here live on the Vine podcast. Welcome again, once again. My name is Akusia Kwachiwa Kranche, and I am here with Mrs. Nunana. Mrs. Nunana, welcome.
Thank you.
And I'm also here with Mrs. Hans. You're welcome. Thank you for last week too. Last week was a very beautiful and insightful moment.
Yeah, we had a good time.
Yes. We studied and then we also learned about new things. We learned about the misconceptions about breast cancer. This evening, as I said, we are here to talk about breast and not just breast. We are talking about breastfeeding and all there is to know about breastfeeding. Mrs. Nunana, last week was very insightful. This week too, we are here. And we're also here to talk about breast and breastfeeding.
Very important topic.
Let's talk about breastfeeding. What can you say about breastfeeding?
Okay, so I'll say good evening to our lovely viewers. Glad to be here again and thank God for this opportunity. I also want to use this opportunity to say a big thank you to our Papa, Pastor Norbert Freeman, the visionary for what we are seeing, the Vine podcast. Papa, thank you so much for the many opportunities you give to us. And also want to say thank you to our mama, who is actually our matron or patron, as you say, for this program. All right, so to the question, breastfeeding. Breastfeeding is the natural process of feeding a baby with breast milk. The breast milk that comes from your breast after you have given birth. And it is naturally from God made. God has created the human being such that after childbirth, there is what we call breast production, which comes out of your breast. And so we say breastfeeding is feeding your baby with that milk that comes out of your breast, simply put.
That's all? You want to add more?
Oh, okay. So I want to add more to what Mrs. Nunana said. So with the breastfeeding, we have types of breastfeeding. We have the exclusive breastfeeding, we have the formula feeding, and then we have the supplementary feeding. And breastfeeding actually starts or is initiated 30 minutes after delivery. Immediately baby is born, it is best that the mother begins to breastfeed.
Yeah, I remember when I gave birth to my children, every time, after delivery, they will advise you to put the baby to breast. So 30 minutes there to 1 hour, they advise that you attach the baby to your breast and start breastfeeding.
Right after birth.
Yeah, sometimes the baby, as soon as they clean the baby, and you are clean, they would want you to start breastfeeding right away.
Amazing. I didn't even know. I thought maybe you have to wait for some days before, because I've heard that people actually struggle to get the milk sometimes after childbirth. So I thought it would take some time.
Yeah, it happens, but what actually helps for the milk to flow is when you attach the baby to the breast. Okay. So you realize that last week we were talking about some hormones, female reproductive hormones, and so for breastfeeding we have the hormone called prolactin. Okay. That is what is released when you have given birth, and so this prolactin helps with breast milk production. And what helps it to be released more is when the baby is attached, it sends signals to the brain. Okay. So it causes more production of breast milk. So if you are not getting the breast milk and you don't attach the baby, or the baby is not sucking, then it's going to be difficult for the breast to be produced.
So mostly those who don't produce the breast milk immediately after delivery are those who have undergone what we call cesarean section, or what the local person will say, operation man. So this is due to the anesthesia. So it takes time for them to produce milk, but then we still encourage them to attach the baby to breast. So like I was saying, I mentioned exclusive breastfeeding, which is breastfeeding with just the breast milk for 6 months. You don't add water, no formula feeding, nothing. Then we have the formula feeding, where you feed the baby on formulas. There's lactogen and one and stuff. And then we have the supplementary feeding, where the breast milk is not enough, or the nutrients in the breast milk is not enough, so you are supplementing it with fortified or nutrient-rich foods.
Amazing.
Yeah,
I'm amazed. I don't know. I'm amazed. I didn't even know that you have to attach the baby to the breast for you to get it. So I'd like to know that in breastfeeding, I've heard mothers say that I want to know that during breastfeeding, does it hurt to breastfeed a child?
Well, so I'll say a yes and a no.
Okay.
It shouldn't hurt to breastfeed a baby. That is if the baby is well attached, what you call latching, because we said that the nipple should be in the mouth of the baby, and so the baby's mouth should be around the areola. What we call the areola is the dark part of the breast, the one that is immediately after your nipples. And so what happens is there is improper latching. The baby are not able to grasp the nipples of the breast well, and so what happens is they pull on the nipple, and so it causes something we call sore or cracked nipples, and so that is what causes the pain, and it's very, very painful, very painful. But if you are able to position the baby well, which we will demonstrate along the line, then you shouldn't have that problem.
Okay, so let's say if there is a problem about your nipple being sore, do you have to continue breastfeeding your child?
Yeah, it is advisable that you continue breastfeeding the child with the sore nipple, because if you don't do so, there will be build-up of the milk, and which can cause what we call breast engorgement, which is equally very uncomfortable and painful, and that one too can graduate into mastitis, which is inflammation of the breast.
Okay, so if you are feeding your child with a sore nipple or cracked nipple, is there no risk attached to it where the child is going to get any infection or anything?
Okay, so the only risk you get is when mother has an underlying condition.
Okay.
Like an HIV positive mother with a cracked nipple has a high chance of transmitting the virus to the child, because there's a wound there, there's a cut, so transmission is very fast. So most of the time we encourage mothers who are HIV positive to either do an exclusive breastfeeding without water, without food. Okay. So if you know you want to do it, that means you have to avoid food, water. The babies intestine is not well developed as at that time. So they are prone to getting diarrhea and other stuff when you start mixing this water and foods for them. Personal hygiene also counts. So that is why mostly mothers who are HIV positive, we encourage them to either do the formula feeding or they do the exclusive breastfeeding.
Just to share a personal experience, when I gave birth to my second child, I had a sore nipple because she had what we call a little of the tongue tie, so she was unable to grasp my nipple very well. But then I still have to continue breastfeeding because she needs it. I believe in exclusive breastfeeding. I did exclusive breastfeeding for all 3 of my children. It is very, very, see my children, they are healthy, they breastfed well. And so it was so painful sometimes, but you still have to continue because the child needs their milk, and that's what will actually also help with the healing. And so yes, whether you have sore nipples or not, you still have to breastfeed, but it's very painful. But look at the bigger picture, and still breastfeed.
Amazing. I would like to say thank you to all our mothers who have been doing breastfeeding and exclusive one. Please do not breastfeed the old ones. They are old, they can fend for themselves. But I want to know if there is any misconception that you've heard about breastfeeding, any myths that you've heard about.
Yeah, there are. Well, the most common one is people think that the breast milk, when we say we should do exclusive feed the baby, as my sister Eunice has said, 6 months without adding any formula, water or anything. They feel it's not enough for the baby. But we are saying here, take it from us, that breast milk is enough for the baby from 0 to 6 months. It has every nutrient that you can think of, everything that we get from food, every nutrient that we get from food. It is so dense in breast milk and overflowing, so it is enough. The other thing people also say that is when you give the baby will be thirsty. No, breast milk is called milk. It's a fluid. It has enough water to satisfy the baby's thirst. So it is never true that when you are breastfeeding, the baby will be thirsty. No, it has everything. It is a complete meal with water.
It has everything.
Yes,
it's a complete meal. Do you have something to say? Me, I've heard that one of the breasts we were how true is this? How would you know which one is
It's the same thing that flows through the left and then the right breast. So it is not true that one is water, one is food. They are all food combined with water and other nutrients.
Because I've seen people, I remember growing up, sometimes our grandmothers, they'll be like, one man like, so does it mean when you start with the left, automatically the right becomes the food?
So I think they are just trying to say when you breastfeed the fuller breast and then it feels empty, you should move to the other one. So maybe they are just putting it in that way.
Okay, so that's the notion behind it, so that you can give your child both breasts.
Yes, but the other thing is we have what we call fore milk and hind milk. And so when the breast is full of milk, when the baby hasn't sucked for some time, the breast is filled up and it's full, and you want to initiate breastfeeding, what comes out first is lighter, and it's what we call fore milk, and it contains a lot of water. And then what comes later on after that is thicker, and that is where we have the dense nutrient in. That is why we always advise that when you are breastfeeding, you empty one breast before the other, so that the baby will get both the fore milk and the hind milk. But if you just give this and then you turn the baby to the other breast, what the baby will be getting is just fore milk, and the baby may not get the hind milk, which has the nutrients. And so I think that is what our grandmothers or parents were practicing, but they didn't really understand the physiology behind it.
Okay, you mentioned earlier, say, that's the breast milk has every nutrient there is for the child to take in. So Mrs. Hans, earlier Mrs. Nuna mentioned that the breast milk has all the nutrients that there is that the child needs. I want to know, are there any benefits of breastfeeding?
Yeah, so there are lots of benefits of breastfeeding. Earlier on, I said we should breastfeed 30 minutes after delivery or when the baby is out. So the reason behind it is that we are trying to prevent hypoglycemia, what we say in our local diet, the baby from getting hungry.
Okay.
Low sugar. Then another reason is that this early or initiation of breastfeeding helps in the release of oxytocin. This helps in placenta delivery. Another reason is it helps bonding, like that mother and baby love. It increases the bond. Then another importance or benefit of breastfeeding is that it helps the baby brain development.
Okay.
The baby grows properly, gets immunity, because breast milk contains some immune boosters.
Okay.
So this increased baby's immune system helps fight diseases and then infection. It also helps the mother to have more love and then affection for the baby. Research also says that it helps prevent breast cancer, like we said last week.
Okay.
And then it also prevents the mother from developing type 2 diabetes, what we say essentially. It also prevents the mother from developing ovarian cancer. So these are some of the...
Yeah, so to add to what she said, the first milk that comes after delivery, we call it colostrum.
Okay.
It is a creamish yellow in color, and it is very important for the baby to have that milk, because it helps with what we call the first baby stool. That you see, when you give birth to baby, they pass to what we call meconium stool. It is dark, greenish dark in color. Okay. And so what happens is this colostrum will help the baby to pass that first stool that clears the baby's gut, which will help the baby aftermath for with good digestion of the milk. So that's the benefits of the colostrum. So it's very, very important that the child or the baby has that first milk. Okay. And earlier on, I was talking about when you are breastfeeding, you should not just give this 5 minutes, one breast 5 minutes, and then the second the baby should empty the one breast before you give the other. So what happens is the milk that I said earlier on, that it has a lot of water in it, and so when you give the baby the first one and the baby sucks the milk, which is water, and then you switch immediately to the second, the baby sucks again another water. What happens? This water affects the gut or the intestine of the baby, and so one of the key things you see is the baby will start having diarrhea or passing greenish stool. So this is one of the cause or the reason why you see baby passing greenish stool. It is because the baby is not taking the milk, the whole milk. You are just giving the baby the milk, which is watery, and so to prevent this kind of diarrhea, you need to feed the baby, or you need to empty one breast before you move to the other.
So what happens if you empty one breast and then you are trying to move the baby to the other breast and the child is full? What would you do with the other one?
If the child is full, the child is full. So when you are going to put the baby to breast again, you start from
the other one.
Yes.
Okay. Thank you. So we would like to know the components in breast milk. And then what here. So say there's B1, B2, B3, everything that we need is in our food. And since we are feeding our children exclusively, do they have all of those nutrients in the breast milk?
Okay, so breast milk contains all the 6 classes of food groups that we have. The carbohydrates, the proteins, the minerals, the vitamin, the fats, and oil. So it's a whole package. God is very powerful. God knows science. God knows nutrition.
The greatest scientist.
Yeah, he has packaged everything in one milk. So the baby will get all the nutrients he or she needs for growth and then development.
That's beautiful. So Mrs. Nunana, earlier I was asking that does it hurt to breastfeed? And then you made mention that sometimes if you don't sit properly, you might actually put yourself in a position where the child is not able to grip the dark part of your breast where so to me so
Areola.
exactly. And see, I want to know that how do I properly feed my baby? What is the proper way to breastfeed a child?
Yeah, so we need to demonstrate that part.
Okay, then I think we will go for a quick commercial break, and when we come back, we will demonstrate how to properly position our baby and to breastfeed the baby so that they get all the nutrients that they need.
Your hands in the name of Jesus. I know some of you think that we are playing or something, but I'm asking God. I am knocking on the gate of heaven, and I'm knocking on the heart of your helpers. Wherever they are now, may they begin to remember you. Anyone that made a promise to you many years ago, many months ago, many weeks ago, many days or hours ago, and they are yet to fulfill it, I knock on the door of their heart and I put your name in their heart. I put your picture in their heart. I decree in the name of Jesus, between now and the next 24 hours, they will call you, they will message you, they will they will call you, they will message you. I enter their sleep, I put your desire in their sleep. I enter their sleep, I put your need in their sleep. I enter their dream, I put your face, I put your name right now. I program your need, I put in the thought of your helpers. They will call you, they will help you, they will call you, they will help you, they will call you, they will help you, they will call you, they will help you. Receive help now, receive help now, receive help now, receive it.
Welcome back, lovely people of God. We are still here at True Vine International Church. It is the Vine Podcast. We are having a nice conversation on breastfeeding. If you just joined us, please don't forget to share, to like, and also to tell your friends that we are live. Yes, we're talking about breastfeeding. Earlier, Mrs. Nuna mentioned that if you do not sit properly to breastfeed your child might not be able to grip your breast in order to get the complete thing that he or she needs. So we're talking about, I want to know how we can properly breastfeed our child.
Okay, so to properly breastfeed your child, there are two things involved. One, position, and then latching.
Okay.
So with the position, you either sit upright, you lie on your back, you lie on your side, or you sit with pillows at your back, or we call it inclined position. Then with the sitting upright, you get a chair, or if you don't have a chair, a stool that you know you are comfortable. It should be comfort. Is
very
number
important,
one. Yeah, because you are going to sit down for a long time.
Okay.
Yeah. Then with the position, so I will choose the sitting upright because I'm sitting.
Okay.
So I'll sit comfortably. First of all, I have to wash my hands. Clean
Very
hands
important.
is good. So this is my baby Kofi. So I'm sitting upright. That is the position I've assumed. Then we have how we carry the baby. We have the cradle and then the cross cradle. So I'm using the cradle method.
Okay.
So this one, the baby's head between my elbow, then my palm under baby's buttocks. Okay. Baby's umbilicus or tummy should touch mine. So I've already taken off my bra, so my breast is exposed.
Okay.
So baby's head in between my elbow, my hand under baby's buttocks.
Okay.
Baby's belly button should touch my tummy.
Okay.
Then I should look into baby's face. I shouldn't frown, I should smile.
Wow.
Because your facial expression also counts. You know, babies, when they are breastfeeding, they look directly into your face. So now I will position the breast. First, I have to stimulate the baby to alert the baby that I'm about to breastfeed you. So I will touch the baby's chin with my nipple. This helps the baby to open his or her mouth. So when baby opens the mouth, I should make sure baby has all the nipple inside the mouth. So the mouth should be wide open. Then the chin or the lower jaw of the baby should touch my nipple.
Okay.
Then the baby's lips should cover at least almost half of the areola or the black portion under the nipple.
Okay.
Then I should sit down comfortably and then allow baby to suckle. Then I can also assist the baby by using my hand to gently press, not so much, so that this can also allow baby to fully grasp the nipple and then take in the breast milk slowly.
Okay.
No, babies that are born right from the beginning may have poor suckle. Their suckling reflexes will be very, when we say suckling reflex, like ability to suckle the nipple, their jaw bones are not so strong, so they will take time to breastfeed. So that is why we say you have to be patient with them. Don't be in a haste.
Okay.
And because they take time to swallow the milk. So I will sit comfortably until baby suckle. From the beginning, baby will start slowly, and then as it increases, baby will start suckling fast. Then I should be sure nipple is inside the baby so that I wouldn't get what we call sore nipple or crack nipple.
Okay.
I should make sure baby has completely emptied the breast.
Okay.
Before turning the baby to the other breast. So for me to know that my baby is full, one, you see that you notice that the suckling begins to reduce.
Okay.
Then baby begins to feel drowsy.
Okay.
Like aso kata nini kakra. Then finally you see that baby will release the breast.
Okay.
So that is some of the signs that shows that baby is full.
Or even sleep along the line.
So if baby doesn't sleep along the line, we call something burping. Like bonechi infama.
Okay.
So the baby must. So when I'm done, let's say baby Kofi is done breastfeeding, so I've released the nipple from baby's mouth. I'll place her on my shoulders and gently tap baby's back for baby to budge. It is to release gas to prevent bloated tummy and then baby having colicky pains.
Okay. That's
Wow.
beautiful. It's so beautiful. It's so beautiful.
Yeah.
So I wanted to ask how you will know your baby satisfied, but she has already answered my question. So I want to know, sometimes our mothers will be like, hey, send me I want to know, is there a timeline? What are the intervals where I need to know that it is time for me to breastfeed my child? Mrs. Hans, please, let's talk about that.
Okay, so it is advisable to feed baby 8 to 12 times in a day, and best is to feed on demand.
Okay.
Feed when the baby wants to feed, not like as a check it time and about 2 hours so baby wait. Immediately you see baby, some baby suckle of want to feed a lot, so you feed on demand. But who will say, or World Health Organization will say you feed at least 8 to 12 times in a day, and then at night also. Don't sleep and then leave the baby lying there. Must feed at night also.
Yeah.
Be my helper.
It's a full-time job.
So me that I am tired during the whole day, and I have to be a watchwoman. So
that's why we encourage families to be involved
supportive,
in the breastfeeding time or postpartum period.
Okay.
So you see in our African setting, you see that our in-laws or our mothers usually come around to help us.
That's beautiful, because if my mother doesn't come to help, I'm sure I'll sleep and leave my baby. So I want to know, are there any challenges that you experience during your positioning? As she said, there are types of position. So if you don't position yourself well, are there any challenges that you will go through?
Yeah, so if you don't position the baby well, you the mother, you get what we call sore nipple.
Okay.
Sore nipple is very painful.
Okay.
And when you have sore nipple and you report to us health workers, we still encourage you to feed the baby on that sore nipple.
Okay.
Another one too, you will get, if you don't properly feed the baby, is that you may get what we call an engorged breast.
Okay.
The breast become very full, tender, firm, and then touch baby well to the breast. Baby will suckle air.
Oh, okay.
So this can lead to colicky abdominal pains. Baby will also not feed well. Baby will be crying, will disturb you always. You see, small time the baby is crying, irritability.
Okay.
They are easily irritated. Another one is that baby will not develop properly. You see that you go to weigh and you see other babies growing fine, their weights are increasing, then your baby will be tiny.
Okay.
Yeah.
So you made mention earlier about breast engorgement. I need more details. What is breast engorgement?
So, like I said, breast engorgement is a swelling of the breast. So the breast is swollen, firm, tender, and painful. This is due to build-up of milk,
A lot of
a
milk.
lot of milk in the breast.
Amazing. Mrs. Una, do you have any other things to say?
Yeah,
about
so
breast
as she says, the breast is overly filled
Okay.
with breast milk.
Okay.
And so as she said, it becomes very hard, shiny, tender. Tender means that when you touch it, it's very, very painful.
Okay.
Okay, so it's as a result of baby not emptying the breast, or you not feeding well, you are missing feeding time. It can cause breast engorgement, and it happens a lot to newly mothers who have just given birth. They sometimes have breast engorgement, and so what you do to release the pain is frequent feeding.
Okay.
Just like the sore nipples. So as the baby empties the breast, it releases or relieves you of that uncomfortable feeling. And then sometimes it's advised that you use a warm compress, a warm towel. You put it on the breast. So what it does is it helps with the flow of breast milk.
Okay.
The breast will flow easily, and then you can express some of the milk
Okay.
and store.
Okay.
Okay, so that also answers the previous question when you asked that if baby has emptied one breast and couldn't take the other, what should you do? Yes, one of the things you can do is express that milk and keep it in a refrigerator for subsequent feeding times, especially when you are not around. And so applying warm compress, resting also helps to relieve a breast engorgement. Yes. And sometimes when we say that if the pain is too much, then you can take some mild painkillers like paracetamol or brufen.
Okay. And then you mentioned that you can express it and keep it for your child to take it later. I want to know, Mrs. Hans, how long can you keep express milk?
You can keep express milk for as long as 6 months, because when you go outside world or the developing countries, they sell breast milk.
Oh, okay.
And some studies show that you can keep it for over a year.
Okay, so how do you keep it? Do you keep it in just a container, you refrigerate it?
You refrigerate it.
Okay. Okay.
In a refrigerator, the deep freezer.
Yeah.
So it's not just the fridge.
Freezer.
It should be in the freezer.
Okay.
And so when you are ready to use it, so you bring it out for it to thaw. Okay, so for it to thaw, to come back to the normal temperature before you give to the baby.
Yeah.
And so sometimes, because if you keep in the refrigerator, sometimes there's fluctuations in the, how do we call the temperature?
Okay.
So it can go bad, or bacteria can invade. So it's advisable it's kept in the deep freezer. That is where you can keep it for 6 to 1 year, not the fridge.
Okay. Okay. Thank you. I saw somewhere online, Snapchat, where one lady gave her child to another lady to breastfeed because she was heading out to do something. Is this advisable to give your child to another breastfeeding mother to breastfeed your child?
No, it's not advisable, because one, as we already established, or as Mrs. Hans said, one of the things for breastfeeding is bonding.
Okay.
Between you, the mother, and the baby. So I don't know what's bonding you want to happen between someone else and your child. 2, what we call the sore or cracked nipples. Some people have cracked nipples, but they don't really know. And if that mother has an infection, even you, the mother, if you have an infection, you can pass it on to your baby. So there are some infections like the HIV, hepatitis, you might not know, and that person can pass it on through breastfeeding to your baby. So it's not advisable to allow another mother to breastfeed your baby?
Yes, I think this is Mrs. Han.
Mrs. Nunana has exhausted. Yeah.
Okay, so earlier on you made mention about supplementary, complementary, and exclusive breastfeeding. I want to know the difference between supplementary and exclusive
Okay.
milk.
So supplementary feeding is a feed or extra food you give to the baby in addition to the breast milk after 6 months of your exclusive breastfeeding. So you are not replacing the breast milk, but you are rather complementing, because as at that time baby's cravings or appetite increases, so breast milk will not be enough for the baby. So supplementary feeding is where the baby is not getting enough nutrients from the breast milk, so you are adding other feed like fortified food.
Okay.
Let's say baby is underweight or mother is sick, so mother is not producing much milk, so you want to add other foods that are high in nutrients to supplement the baby's nutrient level.
Okay, so what about the complement?
That is what she explained the
So
first
the
time.
complementary means after 6 months of exclusive breastfeeding, you introducing family food
Okay, like
to the
The
baby.
solid, the semi-solid
cocoa,
food, yeah.
wheat, tom brown, banku, fufu, rice, yam porridge, and all
everything.
that.
Okay, I get it now. So, Mrs. Nunana, this goes for both of you anyway. I wanted to know, you see, last week when we were talking about breast cancer awareness, you mentioned that everyone and their breast size. Some of us are endowed, others are like me. So if people like me who have the regular type of breast, would it be enough, or is there going to be enough breast milk for my child to feed on? Where I have small breast, can my child still feel satisfied?
Yeah, it's very, very enough. It will shock you to know that those who are batty or those who have big breasts do not lactate well. The smaller breasts lactate very, very well. I quite remember when I gave birth with another woman. She has some tiny breasts like that, but when you see how the breast milk was flowing, and then I was struggling with my breast milk because I felt like I had bigger breasts, so I should have more milk. So it's not so at all. So it all boils down to the hormone that we mentioned earlier, prolactin. Some people have more secretion of prolactin, which causes more production of breast milk. Others to have less secretion. And so it doesn't matter the size. It doesn't matter the size at all.
So there's hope for me.
Oh, so much hope. You'll be shocked. You'll be shocked. In fact, out there, those who lactate more and keep their breast at the bank are people with smaller breasts. Yeah.
Nice. I am very happy to hear that no matter the size of my breast,
you have hope
for me and my baby. So if you're like me, do not worry. There is hope. There is hope. You can see hope in my dress. There is hope. Yes. Wrapping up, I want to know, Mrs. Nuna, I've heard, I don't know how true it is. Is it true that breastfeeding serves as a family planning?
Yes. So we call something lactation amenorrhea method.
Come again.
Lactation amenorrhea method. Yes. Amenorrhea means absence of menstruation.
Okay.
And lactation, breastfeeding.
Okay.
And so it's a form of family planning. When you do it, will exclusively breastfeed your baby. You can go as long as a year without getting pregnant or menstruating.
Okay. So has there been any situation where you are not menstruating, but you can get pregnant?
Yeah, of course.
Yes, because when we ovulate before we menstruate.
Okay.
And so the thing is, if you have ovulated, you may not know that you have ovulated. That is the danger with this method. So you may not know that you have ovulated until your menses come. And so along that line, you can get pregnant if
oh my goodness, it has been good and nice even having this conversation. I wish we had enough time to talk about everything. We'll go on a quick commercial break, and when we come back, you will hear more from us.
Your hands. in the name of Jesus. I know some of you think that we are playing or something, but I'm asking God. I am knocking on the gate of heaven, and I'm knocking on the heart of your helpers. Wherever they are now, may they begin to remember you. Ela parasatima kaparato labaya ifrana mashanda. Anyone that made a promise to you many years ago, many months ago, many weeks ago, many days or hours ago, and they are yet to fulfill it, I knock on the door of their heart and I put your name in their heart. I put your picture in their heart. I decree in the name of Jesus, between now and the next 24 hours, they will call you, they will message you, they will they will call you, they will message you. I enter their sleep, I put your desire in their sleep, I enter their sleep, I put your need in their sleep, I enter their dream, I put your face, I put your name right now, I program your need, I put in the thought of your helpers. They will call you, they will help you, they will call you, they will help you, they will call you, they will help you, they will call you, they will help you. Receive help now, receive help now, receive help now, receive it.
Welcome back, family. We are still on the Vine podcast happening live at True Vine International Church at Abeka Free Pipe. If you just joined us, you missed, but then don't forget that you can always go back on our YouTube and Facebook pages for all that there is to know. This evening, we are having a conversation on breastfeeding since it is the month of October. It is the month of breast cancer awareness, and we are talking about everything there is to know about breast. Mrs. Sunana, I would like to know if you have any last words for our people.
Yes, so soon. It's been a very nice conversation. So my last words, breast milk is very good. Breastfeeding is very good. One of the myths that I left out was people say that when you do exclusive breastfeeding, when you introduce food, that is when you are doing complementary feeding, your children will not eat. It's not true. All three of my children, I did exclusive breastfeeding and they eat very well. All three of them, they eat very well. So it's never true. So please, it helps. It's economical. You don't need money to buy breast milk. So I'll encourage all the women out there that give out their breasts to the babies. It's for them.
Mrs. Hans, your last word.
So my last words, I earlier on talked about the lactation amenorrhea method. For you to successfully have the best outcome is to breastfeed the baby more at night, because this is when the hormones are in their higher peaks.
Okay.
So that's all I want to add.
Yes, there you have it, people. It has been an amazing night. I wish we had enough time so we can continue our conversation. It is the Vine podcast happening live at True Vine International Church. We'd like to thank our father, Pastor Norbert Freeman, for giving us this opportunity, and his wife, Mrs. Princella Freeman. We are very grateful for this opportunity. Coming Friday, we are continuing our 5 nights of answers. It is our 4th night happening live at True Vine International Church, 10 p.m. Come with an expectation. Do not leave your friends' house. Invite someone. Let's all come and share in the glory of God. We'll see you same time next week with a very nice topic. Do not be left out. Kindly subscribe on Facebook and YouTube. For more enquiries, you can call 059 4348 485, 059 4348 485, and we'll give you all the information that you need. I'll see you same time next week with a very beautiful and interesting topic. And it is time to say that I believe in miracles and it will happen to me. I choose joy.
Your hands in the name of Jesus. I know some of you think that we are playing or something, but I'm asking God. I am knocking on the gate of heaven and I'm knocking on the heart of your helpers. Wherever they are now, may they begin to remember you. Ela parasatima kaparato labaya. Ifrana mashanda. Anyone that made a promise to you many years ago, many months ago, many weeks ago, many days or hours ago, and they are yet to fulfill it, I knock on the door of their heart and I put your name in their heart. I put your picture in their heart. I decree in the name of Jesus, between now and the next 24 hours, they will call you, they will message you, they will they will call you, they will message you. I enter their sleep. I put your desire in their sleep. I enter their sleep. I put your need in their sleep. I enter their dream. I put your face. I put your name right now. I program your need. I put in the thought of your helpers. They will call you. They will help you. 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 Receive help now. Receive help now. Receive help now. Receive it.
You've seen all the pink ribbons for breast